So I was diagnosed in the late fall of 2011 with a rare and aggressive thyroid cancer called anaplastic. So they decided to do an experimental chemo once a week, and I did radiation every day for 16 weeks. I then had some complications, mental health being one of them. I didn't realize I was depressed. I didn't realize that I was grieving for the old me. Not being at work, my persona was my work persona. So this was a way for me to give back in a way, but also to help me in my continued journey to get out there and try to be articulate, try to have thoughts, try to, and again, to share my story in ways that might be helpful.
The Patient Family Advisory Council, or PFAC as it's known, is a group of, as it's described, patients or family members, previous patients who have experienced cancer and have committed themselves and are well positioned to give us their opinions and their advice on how the cancer system and how cancer control can be better.
When I was here for one of my follow-ups, when I moved over to Juravinski, I stopped in the office to ask if there was a PFAC here. I then had a couple of interviews and was thrilled to be called and asked if I would join.
The value the PFAC brings, it's quite interesting. First off, they're not just patient family advisors, it's a council. And we get debate, and we get different perspectives, and we can synthesize those perspectives, and we have a focus that's on cancer. It's really beneficial.
It is going to make an impact. They're dedicated to listening to us, to getting our stories, to getting our advice, to asking where things might have fallen through the cracks, where there need to be more dots connected. They're extremely motivated to make this work.
The primary goal is for the PFAC members to make valuable contributions to the care that current and future patients are going to receive. We get their perspectives on what really matters to them and what's important. It also is a fantastic sounding board for initiatives we want to do about, as we have to, try to make care more efficient. How do we make care safer? How do we understand the implications of what we're trying to do in those domains from a patient and family perspective? And what we've learned to do that has been so valuable is to listen and synthesize that message.
Most rewarding, I think, is feeling that I'm actually giving back in a way that is going to be helpful for future patients, for caregivers, for family support, and also from the hospital and the clinical side is the opportunity to share in a group, to brainstorm, to feel that you're impactful in some ways. It's been good for me to be part of a team again. I'm a more whole human being now than I was a couple of years ago. And a lot of that has to do with being involved in PFAC and feeling that I am making a difference.